Sorry. Good morning, everybody. I'm so glad y'all are here today. My name is Jeannie Blake. I am the Director of the Benefit Advisors with the State Employees Insurance Board. I hope you all have your bellies full and ready to listen for some good information, right? What? Oh, they can't hear me in the back. Do you need to turn me up? Okay, so the speakers in the back are not working. So can y'all hear me if I talk, if we're all quiet? Can you guys hear? Give me a hand. Somebody say yeah. Okay. All right. Okay, everybody. So the rules today is we got to be quiet for those in the back. No, I'm just kidding. Okay. All right. So what we're going to do is we're going to get started. I hope we are. Are you sure this is on? Okay. So we're going to thank our sponsors this morning. Miss Lynn Williams is with Blue Cross Blue Shield. She is in the back at her table to the left. They provided breakfast for us today. So let's go on and give her a good round of applause. I enjoyed it, so I know you guys did, right? And then Empower. Nick is in the back. He is to the left as well, and they provided us with drinks today. And then Humana, Miss Nisha is over on the right side, and they are providing our afternoon snacks. So they're going to keep us good, full, and focused, okay? All right, so I know I've already had some complaints in the room about my agenda slide being very small. So I apologize. So while it's up here on the screen, take a picture of it with your phone if you need it. We are going to try to go by this agenda. We're going to try to do it the best we can. Hopefully, I will be able to get y'all out a little bit early today. Y'all will have a good lunch. Yeah, I got to take care of my people. All right. And so we're so glad to have y'all today. I am actually going to introduce our new Chief Executive Officer, Stephanie Azar. She is brand new to SEIB. She's doing a great job. Y'all are going to hear a little bit from her right now. So let's give her a warm welcome, okay?
Thank you very much. Well, I wanted to come here today and just introduce myself. I've been in the role a little under 3 months now and learning a lot and loving the opportunity. But mostly I wanted to be here just to welcome you. As you can see from the agenda, there's a lot of great information that's going to be given out today, and it's always good to be and get more knowledge on your benefits. So what I really want to do today is kind of talk a little bit about how SEIB is funded. So I won't take up too much of your time, but it does matter to kind of know how your benefit health insurance plan is funded. And basically, in general, it comes from two buckets, okay, which would be the employee premium and the state rate. Okay, so we all know what the employee premium portion is, right? That's what comes out of your check, whether you're single, your family, you have a spouse, that sort of thing. So that comes to SEIB to go into the revenue. And then we also have what's called the state rate, which in general is the state of Alabama's contribution for you being an active employee that comes in. It's a per member per month per active employee for the state of Alabama. Okay, so that state rate is very important. And I think one of the things that most people know is that in healthcare right now, healthcare costs is rapidly increasing across the nation. We're not alone. It is every health plan is experiencing it, particularly in medical and drug costs across the board. Drugs are unilaterally increasing 10 to 11% on trend per year. So it's a very expensive program, healthcare in general. Okay. So I say all that to say SEIB for the last couple of years, expenses are exceeding the revenue, okay? And that anybody knows that's probably not the best place you want to be. Well, we've had some reserves that we've been utilizing through COVID dollars and interest on investments and things like that. So what we have to do, and I'm not saying anything here to say the sky's falling, but what I am saying is it's got to be addressed by SEIB the same as it is with every other health plan that's having to look to ensure that we can keep the excellent benefits and the low cost program as possible to our members, which is our goal and what we're going to work to do every day. So I say all that to say yesterday was the beginning of the 2026 fiscal year, okay? And the legislature this last session appropriated $1,025 per member per month, okay, for fiscal year 2026. What you see on the slide now is what we're requesting for the fiscal year 27. which will begin this time next year. You can see that we're asking for a substantial increase from the legislature this year, which is $1,175 per member per month. Okay. So that's $150 per member per month increase that we're asking. Now, will we get that or not? I don't know. But what I can commit to you is that I and the SEIB team are going to do everything we can to educate the legislature and the governor's office on why this is necessary. Okay. And this is going to be very helpful if we can get this right. If we don't, then we're going to have to revisit what SEIB is going to need to do. So earlier this month, the board, 11-member board, the SEIB board, voted to allow and approved for SEIB to seek this per member per month rate on the state side. They also voted some benefit changes that's going to affect the plan as well that you'll see in just a moment, and also approved, and we've already gotten the money to pull from the Retiree Trust Fund, $30.4 million. The reason we did that is to cover that gap where those extra carry forward dollars we've been spending, remember, because expenses are exceeding revenue. And so what we are doing is we are developing a multi-year approach on how we can ease into helping to address the healthcare cost. And we're going to keep you up to date. I would ask you to read your health watch when it comes out. Tell your employees to stay in tune. You can call and ask questions if you need to. But we're developing a plan, hoping that we can get the legislature on board as well to help keep it funded, which, like I said, this is not unique to the state of Alabama. It's not unique to SEIB. That's very important that you know that. Just simply because every other state's health plans, just like this for their employees, are facing the exact same thing. It's the healthcare increase of cost, okay? So I just wanted to share that with you today and let you know that if you have an opportunity, or if you have a legislature that you know, to say that you support that we get this rate, and we're going to be here to support you the best that we can. So I'm going to turn this back over to Jeannie and let her get into some of this wonderful agenda that you have today, and I hope all of you have a great day. Thank you.
Thank you so much, Stephanie. All right, guys, so let's go on and get started. So these are going to be some changes that y'all are going to see for 2026. Why do I hear some moaning back there? Come on. Okay. No premium increases for 2026. Can I get an amen? Wow. So that's great news. We are so glad and so blessed to be able to say that this year. What we are going to see is some changes on our Blue Cross. Okay. So we're going to go through these. The major medical calendar year deductible. You will see it is currently $300 per person, a max of 3 per family. Okay. That is going up by $50. So you will see it's going to be $350 per person, a max of 3 per family. That is starting in January. The inpatient hospital deductible per admission is currently at $250, plus a $25 per day for days 2 through 5 copay. So that's currently a max of $350. It is increasing, okay? Increasing by $50 for day 1 and $25 for day 2 through 5. So the new rates will be $300 for that admission, plus a $50 per day copay for days 2 through 5. So that goes up to $500. That's your max that you would pay. And then the ER copay, it is currently at $250. It's going up to $300. Okay, that's an increase of $50. And then you will notice the ER copay for accidental injury. If you have experienced this in our plan book, you know that it's currently a $0 copay. It is going to now match the ER copay. Okay, so it is going from 0 to $300, which I know looks like a huge jump, but realistically, we were probably one of the few plans that actually still offered a $0 copay for the accidental injury. So it's just going to match. It's going to match what the ER copay is. And then specialty and ER physician copays, they are currently at $35. They're going up to $40. Okay. All right. And then on Humana. So, Humana is the vendor of our Medicare Advantage plan. So currently, all of our members who are Medicare eligible retirees have one card. So the only change that's coming starting in January is they are going to get 2 separate cards. So if you have anybody that either calls on you regularly or is a Medicare eligible retiree that is on the Medicare plan, they are going to get new cards in the mail this year. Okay, they're going to get one for their medical and one for their pharmacy. So they're going to get two separate cards. They are not going to come in the same envelope. So they're going to come in two different envelopes. Two different cards also means probably double the communication from Humana. Okay, so if anybody calls you about all this paperwork, it's about to get more. Okay, and so the biggest thing that you guys will see, it does not impact your network. You're going to enjoy all the same benefits. The biggest things you're going to see is two different cards. And the rule is just take your medical and your pharmacy card to the pharmacy. Starting in January, if you have any members that are Medicare eligible on the Medicare Advantage plan, just encourage them to take both of their cards to the pharmacy to show them in January. Okay. And then, of course, I do want to just briefly mention the federal government has what's called a maximum out of pocket. Currently, it is at $2,000. That means for our Medicare eligible members who are on the Medicare Advantage, once they pay $2,000 for their prescriptions throughout the year, they can sometimes max it in January depending on what they're taking. That is increasing to $2,100 this year. So that's just a little change. And then I wanted to make sure that y'all all knew, if y'all have members that call you about the cards and they start freaking out that they haven't gotten their cards, just tell them to wait. If they've gotten their cards by Christmas, if they haven't gotten them by Christmas, then reach out to us at SEIB or either at Humana, and we can definitely check on the status of that. But at least give us till Christmas. Hopefully they should have both their cards in hand. Okay. Y'all know I love housekeeping. All right, so some reminders. We want to make sure that we are completing and submitting Form 11s, okay? This is crucial for you guys, but this is the only way SEIB receives information about the employee's status or changes, okay? Now, if you're, if Form 11s are hard to get somebody to sign off on or however that goes, you can also email SEIB enrollments at alseib.org just to give us a heads up. Hey, Jeannie Blake is terminating the first of the following month. You can go ahead and give us a heads up so we can go ahead and start to initiate that process. So, of course, just some examples I want to go through. If an employee separates from SEIB, but we don't end the insurance coverage, the member could use that insurance. And so the thing is if they use that insurance the next month after they've terminated, because we haven't received a Form 11 from the agency letting us know that they've terminated, they could be responsible for those incurred claim expenses, or they can have to pay the COBRA rate because they've used the insurance. Okay, so that's something that they might not have planned on, but they use the insurance because it works. Okay, so that's something that we really need to make sure we're doing. And then also, if the member uses the drug policy, y'all, if they get prescriptions, we can't get that money back. Those are called unrecallable claims. So they have to pay that money back. So, for example, if a state employee separates, okay, and they use the prescription pharmacy, what happens is then they're going to get a bill saying, hey, they owe $1,500 for this medication. Well, they're thinking, oh, I don't work for the state anymore. Well, if they decide to come back, which, a lot of us do, they have to pay those unrecalled claims before they can get back on state insurance, okay? So it's very important that we get Form 11s and we do the communication. Now, I know that somebody in the audience today had mentioned transfers and how difficult it is when transfers, if you have somebody going from one agency to another agency, that it kind of gets messed up if the beginning agency terminates and then the second agency starts back up. It can kind of be a little hard process. So the thing is that the way you guys as the separating agency complete the Form 11, that dictates what happens to the person's insurance. So if you terminate someone and you send a Form 11 to us, we're going to terminate them, okay? But if you do a Form 11 that says they're transferring, if you know that they're transferring, of course, I know you always don't know that they're transferring, but if you do know that they're transferring and you send us information that says, hey, they're transferring, we don't necessarily have to terminate them in the system because we know they're starting with another agency, okay? It just creates an easier process for you, an easier process for the member, and also they don't completely freak out when they don't have insurance, okay? Everybody good? Yes. Yes, ma'am. Yes, ma'am. A new IBO2? Okay. So that is what you still need to do. So if you are, I forgot to mention, if you're separating an employee and you're the one that's getting the new employee. So the thing is you're still going to need, the separating agency still needs to do the Form 11. You can put transfer in there. We're going to get with our IT staff because we're not really sure what that's going to look like in our system, but I'm glad that y'all brought it up today because that's something that we can go and get them to kind of work on. They're the magic behind SEIB. But the thing is what we're going to do. So y'all still need to do an IBO2 as the active employee enrollment form when they're transferring because that's how we change which agency pays. So you still need to have the IBO2 necessary. The employee can't change anything because they're transferring. But if you do the IBO2, then that lets us know where they landed. Does that make sense? Okay. Yes, Jean.
So those of us that don't go through state personnel with employees, email, it's still okay to let you know.
Yes. I'm going to tell you yes, and then if somebody corrects me, I'll call you back. Okay. I know, y'all like that, don't you? I'm real good at asking for forgiveness. Okay, so again, the IBO2, like we just talked about, this is the active employee enrollment form, y'all. This is crucial. This is how we know you have an employee in your agency. We want to make sure that you complete that form and send it back along with the other group health insurance addendum. Now, I also want to make sure that y'all are aware, because I know this can get kind of confusing. Only the employee has medical coverage effective their hire date, okay? So when you have somebody come in and they say, well, I need family coverage, that's great, and we can make that happen, but they will not have family coverage effective their hire date. It is only the employee. So dependent documentation, it's so much easier if y'all will just make it a routine to go ahead and bring it the day that they process in. It's so much easier. You need a marriage certificate. You need dependent birth certificates. Okay. It's so much easier just to have everything all in one packet. Now, dependent coverage will begin the first of the following month unless that back premium is paid. Okay. So how that works is whenever the new hire paperwork comes in, we see you want family coverage. Okay. So what we're going to do is SEIB is going to process that information and we're going to send a letter in the mail. The letter in the mail looks like junk mail. Somebody new to state insurance probably doesn't know who SEIB is. Make sure you tell them, hey, be looking for a letter. Everything that comes from SEIB comes in a letter, okay? And so that's where they're going to get the letter that says, hey, if you want dependent coverage to start effective your hire date, you owe $190 or whatever that back premium is. And they will not have coverage for their family effective their hire date unless that back premium is paid, okay? Otherwise, it will go first of the following month. That kind of makes sense? Okay. And then I do just want to say, y'all, enrollments, give us 7 to 14 business days for processing once we receive the paperwork. Okay, so the thing is that you guys as the agency, I know some of y'all have to go through Montgomery and it can take a little bit longer, but the employee, I know they technically have 30 days to get their paperwork in. The sooner the better. Because once you send it to wherever you have to send it to, then it has to come to us, and then we still need time to process it. Okay, so it all, I know everybody's like, oh, I started today. I want to have my card. Well, unfortunately, it's not that, not that seamless yet. I'm sure we will be one day, but we're just not quite there yet. So we want to make sure that as soon as you get the paperwork completed, y'all go ahead and do what you got to do. If they bring documentation, it's easier, and just go ahead and submit it directly to us so we can be faster so that your employees can have their insurance faster. All right, so now we're just going to chat real quick about our reemployed state retirees. I know we really went into this last year. Y'all have been doing a great job getting your IB-17 completed, 17s completed, which is great, and sending them to SEIB if they are expected to work the 10 or more hours per week on average. So we want to make sure if the employee and or their dependents are Medicare eligible, the base premium for that reemployed Medicare or state retiree will be the non-Medicare premium plus or minus the sliding scale adjustment. The thing is that if you don't want to get into how much it's going to be, they can call us, okay? We'll be happy to help them. Now, it is also very important that SEIB be notified, again, by that Form 11. Or if you just want to send an email to SEIB enrollments, when that reemployed state retiree is no longer employed, so that we can change their status if they're Medicare eligible. Okay? So let's just say you have somebody that is working and they're 70. That's great. But they say, you know what, I think I'm going to separate on the 1st of November. They have to have their Medicare A and B in place. And then you have to let us know that they have separated or resigned or whatever it's called. Because the thing is they're going to be swapped over to Medicare Advantage. Okay, so that's very important because while they're working anywhere from 10 to 29 hours per week, Medicare says that we have to be the primary payer, even if they're Medicare eligible by age. Okay, so if you have an employee that's 68, 70, they're going to be covered under the Blue Cross Blue Shield until they separate and they are no longer working that 10 to 29 hours per week. Very good. So, of course, this is just, I have been informed. I don't know anything about the codes because thankfully that is not part of my job. I know all of you are very familiar with this though. And so these are the codes, of course, that we use for the HRM system. I think that's what the new system's called. And so we want to make sure that y'all are using these codes consistently. You're not deleting any existing codes. You're not creating new codes, that these are the codes that y'all are using. So, I think most of you guys, we use the A4 because that's the full-time employee, which of course, effective yesterday, the funding rate is now the $1,025. So we just want to make sure that there is no editing of existing codes going on. Okay, y'all, guess what? We're getting a new website. And it is going to be so pretty. I'm so excited. So I'm about to show y'all a little bit about that. Hopefully my IT guys tell me next week might be the go live launch. So I'm super excited. And then there's also been a 2-factor I don't know how to say that word. Anyway, there's been a 2-factor. Y'all know you see it everywhere because the thing is you got to do it with everything that you have. So there's going to be now a 2-factor that is going to be required to log into MySeed. Okay. Last year, you probably got some members that were like, hey, I don't know what this is. This year, when they get ready to get in their MySeed account and do their flex and do their changes, they're going to be complaining about this again. Okay. So it's coming. So just have them reach out to us. We'll be happy to help them with it. And then also, we do have a new phone system with SEIB. We will have new phone numbers. You will start seeing on our signatures, there's going to be new numbers that y'all are going to want to update your information. However, the old numbers are still going to be transferred for the time being. Okay, so now we're going to go over fun stuff. This is what the 2-factor looks like, okay? So this is for your MySeed account. This is one that's your own personal health portal, remember? You're going to do your new username, your password. You're going to have to put that you're not a robot. And then, of course, this is where you're going to get an email. You're going to get an email, whichever email you have it set up. You're going to get that 2-factor code. You're going to have to enter that 2-factor code before you can get enrolled, okay? So make sure that we know exactly what email everybody's using so we can get into our system. And then this is what our new website's going to look like. Where are the oohs and ahs? Isn't it so pretty? So pretty. And so, y'all, this is what our new website's going to look like. It's going to be streamlined. It's going to be clean. It's going to have the tiles. It's going to look so great. I'm so excited for it. I hope y'all are too. And so, of course, we're just going to run through a couple of things. You'll see where the employees at the top. You're going to see all your tiles you have at the top. It's going to be super easy to find. Hopefully a lot more user-friendly. So for the employees that come in, I know our website right now is kind of a lot of words. And so hopefully when the employees come in, this is going to make it easier for them to go and find a lot of information themselves. And so this, of course, just talks about our health insurance benefits, our standalones, our eligibility, our premiums, our discounts, and flex. So really, really just straightforward out there. And then, of course, we have a section for non-Medicare retirees, those under 65, and then our Medicare retirees. So those are separated out so they can find that information there based on what category they fall. And then our benefit premium rates. So you will see, you can go to our premium rates and they will all be listed right there. Okay. And then what happens is you can click on them and look how clean that looks. Doesn't it look great? And so the thing is, instead of that sheet that y'all have no idea what it means, when you look on this, you can see employee only, $30. You have all the discounts. Okay, $220 family without a spouse. Family with a spouse is $245, and then the discounts are listed below. So if they, of course, need to figure out what their premium is, you just add the discounts to that. Okay, but these are the base rate. These are the rates after all the discounts are applied. And then, of course, it just goes through retirees, kind of like it did with employees. You go to wellness, you can have your preventative screenings. You see that information there. You also see screening locations. Now, I do want to mention that the Wellness Center is now going to launch their own app where you can schedule your wellness screenings online. Okay, so that is something new to stay tuned for. I don't really have a lot of information on that yet, but it will be on our website, and I think it's going to be a pretty easy step-by-step process. So that'll be good. And then these are all our forms. Remember how right now we have a drop down and then another drop down? Y'all look, all our forms are right here. Okay? Enrollment membership forms, discount waiver applications, flex, miscellaneous. It's all right here on one page. And then, of course, we have our resources like the Baby Yourself, the Hinge, the Blue 365. These are those free resources that you want to send members to just to kind of look over. This is a lot of stuff they can educate on themselves that they're available as a state employee. They have available. And then, of course, this is your favorite page because it's the benefit advisors. Yeah. All right, so of course, I am currently working on getting somebody for the North Territory. So right now you get myself and Kristen. Kristen's over here with me, and so I take care of the southeastern part of the state. Kristen takes care of the southwestern part of the state. We are both tackling the North Territory, and then we split Montgomery. And so you guys can get us, of course, all of our forms and everything are on the bottom. You can contact us directly by email right through this page, which y'all know how to get us. All right, and then of course our contact information. This is all the information that we will have on our contacts. Now these are the updated numbers, so if you want to go ahead and take a picture of the slide, please feel free. It has our updated numbers, but you guys will have this. It'll be available on the website whenever it's published. What did we do before phones? You know? I know. Like, what did we do? Okay. And then, of course, this is just talking about the Steve Wellness Center, Clinic and Pharmacy. You can see that it's located on the website as well. And then news and updates. This is where we are going to try to plan and present and have all of our news, our updates. I'm not real sure what all is going to go on this page, but I know it's going to be good, so stay tuned. All right. Everybody good so far? Any questions? All right, so I'm going to, yes, ma'am. There's going to be a copy on the website. And it'll go out through Constant Contact. Yes, ma'am. I don't know how it's going to work, but it's going to go. All right. So now I'm going to get Mr. Joe Hocutt. He is with Southland. He is going to come up and talk to you guys a little bit about our Southland benefits. And then let's give him a warm welcome, okay?
Thank you very much. I always appreciate you allowing me to be here. Just wanted to cover the Southland benefit plans that are optional. First of all, a little bit about Southland. We've been in business since 1933. I've been doing business with the state since 1983. And very proud of that fact. From an administration side, customer service, we are very happy that we do not use an IVR. When you call, you talk to a human being. We answer the phone within 3 rings. You pick up, you talk, and that's really important for providers as well, so that they can check eligibility, spouses, and dependents. The other thing is to keep providers happy and our network really strong. We pay all of our claims. Well, we pay 96% of our claims within 10 days, which is well above the industry standard and with a 99% financial proficiency. We've been recognized as one of the top call centers in the country numerous times. And on our commercial business, we have a customer retention rate of over 95%. So we're very proud of the fact that once we get someone using our services, they're pleased with our services. Privacy and compliance is very important. Knock on wood, we have not had a security breach, and we do that through a process. We feel very important about that. Obviously, we keep your patient information very private, but in addition to that, we go through an annual audit. Is a SOC 2 Type 2, which is recognized internationally as they come in and look at our SOPs, look at our operations to make sure that we follow those operations. And just like you do a financial audit, except it's on your SOP for your operations of paying claims. DentaNet network, this is for dental. We own our own network, so we do not lease it. We own our own network, so we have contractual agreements with the providers around the state. We're one of the largest networks in the state, and if not we've got over 1,700 dental providers, and we credential those to the standards, national standards, to make sure that they comply. And what's unique about our network opposed to other networks with some commercial carriers out there is the fact that we're just not in Huntsville, Birmingham, Montgomery, and Mobile. We're throughout the state. We're in Barber County. We're in Greene County. We're in Choctaw County. We've got providers very deep in the state. Why dental is very important to you, and especially the wellness piece of it, or the oral exams, is that it's the first place that you can identify inflammation in your system, and which is a leader of other major diseases. So it's important to go in and get your teeth cleaned. Also, it prevents gum disease and heart disease. Again, the inflammation shows up on your gums before it ever shows up on your arteries and things like that. So if your dentist sees that you have inflammation on your gum, it may recommend you to go to your primary care physician for that very reason. Increased confidence. Obviously, the cleaner your teeth, better your smile, better you feel, right? So that's all good. The other thing is, by getting regular exams, you avoid costly procedures. Obviously, a filling is much less expensive than a crown or a cap, something like that. So you get that. Also, I don't care how much you floss, how much you brush, and things like that, there's always going to be plaque and tartar up under your gum line that you cannot get to. That takes a trained hygienist to go in there and clean that up. And then just for positive lifestyle, it's always good to have your teeth. Again, when you go in and see the dentist twice a year, it's already covered with a plan anyway. You're seeing someone with a medical degree, and they can spot other things about you. Most of you see your dentist probably, or a lot of people see their dentist more times a year than they see their primary care physician. Dental plan summary: there's no changes to the benefits. Again, preventative services are covered at 100%. There's no deductible if you're an individual, or $25 if you're a family. Basic and major services are covered if you're an individual at 80%, which is very, very rich, and 60%, which is rich in the marketplace, because most of your major services on commercial are only covered at 50%. Large annual maximum benefits for an individual is $1,250, and for a family it's $1,000. And the dental plan coordinates with any other dental plan you may have. So if you've got multiple plans, the spouse or an individual plan, we coordinate with that to make sure that there's payments made. So here's just a summary of what I just told you. So I won't be redundant and read that again. But here's some examples of savings. Typical filling, network rate, $99. What we see, and there is no set retail rate that's by the dentist, but if they're in network, they've negotiated to a $99 fee. In the marketplace, that's double to double and a half. So, it could be anywhere from $200 to $250 is what you'd see for a filling. Our negotiated rate is the $99, which means they write off the rest. So your members would not be balance billed. So if you're an individual, you'd go in, it's covered at 80%. So the insurance would cover $79.20. So you'd walk out only paying $19.80. For the family, assuming that you've not met your deductible, which would be worst case scenario, the plan pays $59.40. Your out of pocket would be $39.50 plus the $25, so it'd only be $64. So you'd only be paying about 25% of what the retail rate would be if you did not have insurance. Same thing, I just want to do on a higher price item. On a porcelain crown, the negotiated rate is $625. In the marketplace, you'll see that anywhere from $1,300 to $2,300 for a crown. Again, they've agreed to the $625 price. We paid it to $500. Out of pocket, only $125 for an individual, and kind of the same thing as you get to a family, only $275. So significant savings there. Vision is the other coverage. Live vision. Well, 75% of all people in the U.S. need some type of corrective vision. Eye exams is another reasons you want to go, is because the eye exam is very important, especially in identifying if you're a diabetic. I have an old college roommate. We were talking how he found out he had diabetes. He was getting his eyes checked. Doctor said, you need to make an appointment right now with your primary care physician. He asked why? Because as they did the retina scan, look in his eyes, they saw blood on his retina. I mean, not blood, but sugar on his retina. And that's why they identified that he had diabetes. He went, got diagnosed for it. So his dental exam was what spotted that, nothing else. Eye exam can identify hypertension as well. And my wife's a teacher, and 80% of children are visual learners, so it's also important to make sure you get your children tested. So that's very important for members to remember. Plan summary. The eye examinations, we'll get into what they cover. It covers frames, it covers prescription lenses or contacts, and there is no provider network required. So you can go to any eye doctor you want to, any provider you want to, and it pays. And it also coordinates with other plans that you may have. Again, the eye exam, it pays $95. That's very rich in the marketplace. Okay, so that's a great benefit. It pays $95, pays up to $95 on frames, and then depending on your prescription, whether you're single, bifocal, trifocal, or lenticular, it can go anywhere from $100 to $205. And the contacts, it'll cover $180 per year. The other thing about this plan too, that a lot of commercial plans, you can only get eyeglasses every other year on a lot of commercial plans. This is every year. It comes up and you can do it. Next is the cancer plan. No change in plan, no provider networks required. The cancer plan pays employees direct, which is very, very important. All we need is an oncologist report with a hospital bill or a doctor bill, and it's paid out. The policy covers certain cancers. Coverage provides $350 a day for hospital confinement, inpatients, and $500 thereafter. Actual surgical charges are paid up to the amounts listed in the plan booklet, up to a max of $2,400. An actual plan subject to a lifetime maximum of $10,000 for radiation and chemotherapy. Benefits provided regardless of other insurance. That's really important, regardless of other insurance. Remember, one of the plan changes this year, or the change they had to make, is increasing the deductible or increasing the hospital stay. So with this plan, if you go in for cancer, you're going to get paid this money direct. So that's going to go a long way in terms of covering that deductible and your daily expenses related to cancer. Same thing is true with the hospital indemnity. In-hospital daily benefit as an individual is $150. A family plan, $75. So again, this plan covers that differential of what maybe you've seen in plan changes. This would cover that if you had this coverage. You've got the maternity, ICU benefit, $300, $150. Long-term care, $150 to $75. Then the supplemental accident. Again, it's $1,000 that you would get, and then the ambulance benefit of $100. So the other thing that comes free if you get any of the Southland plans is the True Hearing. And the True Hearing is really it's a discount plan that you have access to. And it's through True Hearing. It's what you call a concierge service, because you have to go through them to set it up, but they're getting paid a dispensary fee for hearing aids if you need them. And it's going to be used to anyone in your household and your parents, okay? Or really any family member. You contact True Hearing They'll set up the appointment for you. They go in for the initial appointment, get fitted for equipment if hearing aid, if it's required. You get the discount for the hearing aids. They get it in, they do the fitting, and then after that, they have some extended warranties and batteries associated with that as well. That's the things we offer Southland. So I will entertain a couple of questions before I turn it back over to Jenny. Yes, ma'am. Yes, that has come up, and that's something we are going to talk to if they want to change. Y'all are self-funded, so it's something we'll talk to them to see if they want to change that, because immunotherapy is a new process and different than the chemotherapy. So that's something we'll be in discussions on, and we'll get a clarifying statement with you on that a little bit later. Okay? Good question, by the way. You're up on your cancer. Hopefully it's not by experience, it's just reading. Go ahead, ma'am. Yes, the question was on progressive lenses. If you get progressive lenses, they pay at the trifocal rate. So that's kind of one and the same in the way we pay those. So it is definitely progressive. Yeah, good question. All right. Thank you very much.
Thank you so much. Okay, thank you so much. Thank you, sir.
You're welcome.
All right, everybody, continuing on. We're going to talk about our wellness program. So our wellness program benefits. Of course, you guys know we have the preventative screenings. That's how you qualify for the wellness premium discount, right? We also have Teladoc. Those are the online doctor in your phone. Y'all all use Teladoc? I love Teladoc. Y'all know I have little people. We get sick on Friday nights and Sunday afternoons. I don't know about y'all. So the thing is you can pretty much have a doctor in your phone. You don't go to the urgent care and pay a $75 copay to catch the flu when you're just trying to treat pink eye. Okay? Berta Health is a type 2 diabetes reversal program. You are going to hear from Kelly just shortly, but you can go visit Kelly and Lisa, of course, at the back at the Berta table. We also have Hinge Health here today. Miss Brooke Elmore, I hope you guys have visited her table. It is a treat pain at home with an exercise therapy. It is pretty much a physical therapy team in your phone. Has anybody used Hinge? I know it's so good, but there's not enough hands up. Y'all, you're going to love hearing from Brooke today. Blue 365 is a health and wellness discount program through Blue Cross. It is not something that is just offered through SEIB. So this is a huge program that has a whole bunch of different discounts from really places all over, not just in Alabama. So it's definitely something that you guys want to check into. We also have our tobacco cessation program. We do it through 1-800-QUIT-NOW. So our members can complete that tobacco cessation program so they can get that non-tobacco user discount. We also have physician supervised weight loss and nutrition counseling programs. You can find all of that information on our website. It will be even easier to find when our new website is up and running next week. And then the Baby Yourself program is offered through Blue Cross. You guys, this is a great program for your employees that are going to have a baby. Okay? So I use myself as an example because I had a panda baby. I had a little pandemic baby in 2020. Best hospital stay, no visitors. It was great. So the thing is that the Baby Yourself program is something that if you enroll before the third trimester, it waives your hospital copays. Y'all, literally, I paid nothing to have a baby. Okay, so it is something that's available through Blue Cross. Not every single one of the Blue Cross plans opt in to have the copays waived and the premium or the deductible waived. So that's a great benefit that the state offers. Okay, so this is definitely something that you want to make sure to tell those little mamas to be. And then our annual wellness screening. Everybody's gotten their wellness screening? Yes? All right. So the Wellness Center is actually out that door to the left. They are doing wellness screenings and flu shots today if you would like to. I got mine yesterday. It was just a joyful experience. It was great. They did a great job. And my friend Kristen can't say the same, but she's good. So, who is required? I know, bless her. Kristen, I just called you out. She's my little friend that passed out yesterday at our wellness screening, y'all. She just can't take blood. All right. So who is required to participate? All of our active employees and our covered spouses in the CHIT group 13,000. Y'all, that's the basic medical coverage. That's the Blue Cross. If you're enrolled in that plan, you got to get your wellness screening. Okay. It's very important. Where can you go? Your work site. It's the easiest place. Just sign up when they put the sign up sheet. Okay. You can go to the county health department. You can go to the state wellness center if you're in or around Montgomery. You can go to participating pharmacies. There are a lot of different pharmacies in a lot of different counties that participate. Of course, Publix Pharmacy is one that's widely accepted throughout the state. Now, since COVID, their schedule's a little different. They want you to call and make an appointment for a wellness screening. I know that's kind of newish in the past 5 or so years. So, and if you don't want to show up and get turned away, call and make an appointment. You can also go to your healthcare provider. Now, everywhere that I mentioned previously is going to be free. You can go get your wellness screening done. It's not going to cost you anything. If you go to your provider's going to charge you a copay. So don't be mad when you show up, okay? They're going to charge you a copay. You also have to take the IB-13, which is the provider screening form, okay? You have to take it, give it to your provider, ask them to fill it out. The sweet girl at the front desk is probably going to say, don't worry, Jeannie, I'll send that back for you. Guess what? I used to be her, and I don't care nothing about your wellness screening, okay? So the thing is that it's our responsibility, okay? Our wellness screening is our responsibility. So what I do is if I go to my doctor, I say, hey, girl, can I get a copy of that? Because the thing is, I'll let her send it, but I'm going to double check her, okay? Because I care about my discount just like y'all do. That's the same for any state employees. I'm a state employee just like y'all are, and guess what? Nobody cares what we pay except for us, right? Okay. So, of course, the health risks that are evaluated. We're testing for 4 risk factors: blood pressure, cholesterol, glucose, and BMI. The key is, y'all, we want to prevent strokes and heart attacks. If we prevent strokes and heart attacks by catching one of these risk factors, if it's elevated, then we save our plan money. If we save our plan money, hopefully we keep our premiums low. That's the key, right? Of course, if you have a referable value, what happens? You're determined to be at risk. Let's say you go get your wellness screening done and your blood pressure is super high. Well, what happens is we're going to give you a provider referral. We are going to send you to your provider free of cost, okay? What we're going to do is hopefully you and your provider are going to talk about your assessed risk. Either you need medication, you need some dietary modification changes, or you just had a rough day at work, okay? So the thing is that the screening is not complete until we have received the completed form from your doctor, okay? Again, if it were me, I'd probably get a copy of it, and I would send it directly to wellness myself. However, you can allow the doctor to do it as well, but I would always get a copy, okay? I have a copy of my wellness screening right in my purse from yesterday. Because guess what? We're all human. Fax machines sometimes don't work. Emails, all the things. So it's our responsibility to make sure we know that our discounts are in place. All right. So, of course, preventative screenings, like we talked about, they're going to help you to stay healthier, prevent illnesses. That's why we have partnered with Blue Cross Blue Shield to administer this program, okay? The key is we want to do prevention. Prevention is key. So while some preventative screenings are recommended on an annual basis, others are recommended on your age and or your gender and or your diagnosis, okay? So that's why we have this preventative screening plan in place. So the wellness program preventative screenings that we currently monitor. Breast cancer screenings. You will notice that here it used to be 50. It is now 40. Okay? Breast cancer screening starting at age 40 every 2 years. This is not necessarily when you need to go get your first mammogram. If you have somebody that says, I'm 35 and my doctor says I have to have a mammogram, go on and get it. That's good. This is just when we start monitoring for the discount. Okay? Cervical cancer screenings. Females age 21 and older. We got to have one of those every 3 years. Okay? Colon cancer screenings. This is for everybody. Age 45 and older. This is for you and the covered spouse. You can go to the doctor's office, get a little blood test. It lasts once a year. You can do the Cologuard where all your neighbors will know what you're doing, but that's okay because you're going to get your discount, right? You can also go and get a colonoscopy if you want to with your doctor. You and your doctor feel like that's the best choice for you. That's great. When people start seeing this, they freak out because they're like, oh my God, I don't want to get a colonoscopy. You don't have to have one. If you want one, you can, and it'll last for 10 years. You can also go to the doctor and just get one at the doctor's office. Okay, but you got to have a colon cancer screening. Also, a diabetic eye screening. If you are a person with diabetes, you have to have a diabetic eye exam every year.
Can I ask you a question?
Yeah.
Sure. This is a personal experience question. My husband has diabetes.
Okay.
We get told he's diabetic eye screening.
Mhm.
So it's pretty hard sometimes, or maybe an easier way. It's pretty hard sometimes to figure out where to go, who will do it, because we don't have vision. A couple of times we've paid the whole thing. A couple of times we've asked him to try to file it on medical. So is there an easier direction on how to take care of that one? If somebody doesn't have vision insurance, or however,
So
what's it supposed to fall under?
well, I feel like my personal experience, I feel like falls under medical. So I feel like your medical eye, because they're really just testing the pressure in your eye. So I would think that that would be something that could be done by your medical doctor. What I'm going to do, she asked about the diabetic eye exam and if there's an easier way to get it if you don't have the vision insurance. I don't have 100% a good answer on that, but I do want you to just send me an email and let me ask the question. I would think it would be filed under your medical because, like I said, it is a medical eye exam. But let me double check. Okay. So the answer is I don't know yet, but I'll figure it out. Okay. I wanted to make sure I told y'all one thing I forgot about this. So the thing is, y'all, is these are claims based. Okay. So what happens is Jeannie goes to the doctor. She gets her mammogram. The doctor files a claim with Blue Cross. Blue Cross then takes it from the doctor. Then Blue Cross sends it to SEIB. Okay. So the thing is, it can take 90 days for all of this information to get from the doctor to SEIB. So don't call me the day after your mammogram and say, hey girl, you got it? No, I don't. Okay. So the thing is, it's going to take about 90 days. So if you want to go ahead and send it to me, if you have information that says, hey, I got this done, it's from your doctor, that's great. You can send it to our wellness team and they will go ahead and get that processed. But just know it takes time to get all of that information through the system. Okay? All right, any questions? Okay. All right, I'm going to have Ethan Ivey come up. He is with the Alabama Retired State Employees Association, and he is going to talk to you about that program. And then also, I think he has some door prizes.
Okay. Thank you. Can y'all hear me in the back? Awesome. Okay. Wait, am I good? Great. Okay. So my name is Ethan Ivey. I am with the Retired State Employees Association and the Alabama Public Employees Advocacy League. I know that's a mouthful. I'm sorry. What we do is we represent all of the retired state employees and all of the local government employees at the legislature. So we represent you as retirees, and we advocate for your RSA retirement. And then we also work with the State Employees Insurance Board to make sure that you get that full funding for insurance. What we also do as for our retirees is we keep them up to date about insurance, retirement, Social Security, all that kind of stuff. Because as employees, you have those, water cooler kind of conversations of how insurance works and how retirement works. But once you're a retiree, you're just kind of at home and you don't really know what's going on. So what we try to do is keep them up to date about all those changes. I am doing a door prize. If you want to go and fill out one of those cards on my back table there, we're going to do that drawing at lunch. And then I also have an envelope for any people that you have that may be retiring soon. I've got some information in these envelopes for them if they have any questions. So feel free to come visit me at my table. Thank you.
Thank you. All right, y'all make sure to sign up for those door prizes, okay? All right. Now I see Miss Lexi. She just walked in. She already knew I was looking for her. So I'm going to bring out Lexi Solario. She is with our personnel department, and she's going to talk to y'all about paid parental leave. Okay, y'all give her a warm welcome.
Thank you, Jeannie. Okay, the most exciting topic that everybody wants to talk about, paid parental leave. Obviously, the new benefit here. I won't try to. All right, and I think most everybody is somewhat familiar with it, especially if you do personnel. You've heard, probably from us entirely too much. You're probably tired of hearing about it, but it's very important. It's relatively new. Just a little bit of a timeline.
We did see this legislation introduced last session, but it didn't pass until the 2025 session. All right. It did pass in April, but it had an effective date of July 1 of this year. All right. It is obviously a relatively new benefit. I think when I ran the numbers maybe like a month ago, we had like 30 something people use it. So obviously there's a chance that you've not encountered somebody at your agency using it yet. So if you do have any issues or questions about it, obviously we're here to help you in any way we can. Okay. The law that made it all possible, Act 2025-81, it's where it basically detailed exactly the benefit, the paid parental leave benefit, and we'll talk about all this in more detail. But high level, it does apply to an employee or an eligible employee that has a birth, stillbirth, or miscarriage, or adopts a child 3 years of age or younger. All right. And the amount of time an eligible employee can take paid parental leave is going to vary on if they're a female or a male. And we'll talk about that in more detail as well. With obviously this law change, we did have to update some of our board rules regarding this subject matter. Specifically donated leave, I think a lot of us are probably familiar with this benefit as well. But with the new paid parental leave law, it did actually take away donated leave for maternity and adoption purposes. All right. Donated leave obviously is still available for a catastrophic illness or injury, but it's no longer, as of July 1, going to be available for maternity or adoption because obviously paid parental leave is the new benefit here. Okay. So we did update our board rule for that. We did file an emergency rule July 1, which that is the current rule, but we also went through the normal rulemaking process as well with our permanent rule becoming effective October 13th. Okay. But like I said, the permanent rule is just exactly the same thing as the emergency rule. We just had to get it out there. Also, we have a brand new rule, the paid parental leave rule. Really all it does, it sort of details the law that we already have read and we're familiar with. We add a little bit more detail and guidance than the law already does. Like I said, we also had an emergency rule filed July 1, went through the rulemaking process with our permanent rule being effective October 13th. I think that this, for the most part, is not surprising. I think we've put, or given all the rules to your personnel office so that they're aware of it. And also, if you're personnel, you've seen our really fantastic, elaborate manual that you may or may not like. I know it's a lot, but I think hopefully it has been super helpful to you all as a resource. In the manual, we obviously go into exactly what the law details, what it says. We also have a very extensive FAQ section that I feel like we answer a lot of questions, even though I know I've still got some questions. We're obviously still happy to answer that because it's hard to think of everything at the end of the day. Also, in the paid parental leave manual, remember you have a sample policy. The law does specifically require your agency to have some sort of paid parental leave policy. So like I said, we're not trying to reinvent the wheel here. You're more than welcome to use that sample policy and alter it the way that you see fit. Also, in the paid parental leave manual, we also have a certification form. That is a requirement for all agencies to use. We're making sure that not only the entities that fall underneath our purview, like merit system agencies, but also the judicial branch, the legislative branch are going to use the certification form as well as even the entities that don't fall underneath us, like the local boards of education and community college system. We're all using the same certification form, all right? So that doesn't mean you can't put your logo on it or make it a little prettier, but the information should remain the same on the certification form, okay? And if you do require any additional information, we'll talk a little later on, you can require that in the written plan. Yes, ma'am. I will give my email address and I'll be happy to send it to you. We did send it out to personnel managers, but I know sometimes smaller agencies didn't have the contact. So if you have something to write it down with, I will give it out to the masses right now. Okay, it's Lexie, Lexie, dot Solorio, SOLORIO, at personnel.alabama.gov. And I'll be happy to send that to anybody that does not have it. Like I said, it wouldn't surprise me if some smaller agencies maybe did not receive it. So please reach out. Any other questions about that? Okay. We'll keep on trekking on. Okay, eligibility. Employees have to have 12 consecutive months of service prior to the qualifying event in order to be eligible for paid parental leave. The big difference here that's different than the FMLA, which personnel people are familiar with, is your eligibility will follow you from agency to agency, which that's not the case with the FMLA. So if you work, and I'm not trying to pick on anybody, like I see people out that I know, like if you work at RSA for 6 months and then you transfer to ADEM and you work for another 6 months, you'll have those 12 consecutive months of service. All right. So that is one unique thing about paid parental leave is your eligibility does follow you, okay, from agency to agency. Also, who are eligible employees is listed in the legislation, but also listed here. Really, it's employees of the legislature, really anybody in the court system, and basically anybody that falls within, obviously, the merit system or anything classified, exempt, unclassified, all of those are going to be covered under paid parental leave. Obviously, in addition to the two entities that are not underneath us, like local education agencies and community colleges, they do not fall underneath our purview, but education and community college system are basically doing the same thing that we are doing to make sure it's consistent across the board, okay? And one other thing that I'll probably say too many times, but I think it's really important to remember, is you can only use paid parental leave one time in a 365-day period. It does not matter if the employee experiences multiple qualifying events. They still only get one use of paid parental leave in a 365-day period. All right. So how much paid parental leave can an employee get? For the birth, stillbirth, or miscarriage of a female employee's child, they'll get 8 weeks. Okay. For the birth, stillbirth, or miscarriage of a male employee's child, it's 2 weeks. All right. I didn't make this up. It's specifically written in the law. So I'm just obviously giving the information, but that's the amount of time those employees can get. If an eligible employee adopts a child 3 years of age or younger, then an employee can get 8 weeks of paid parental leave regardless of their sex. The kicker here is if you have two eligible employees, maybe they both work, you have the mother and the father working at two different state agencies, then one will get 8, one will get 2. Also, maybe the more complicated part here is those agencies do have to communicate which is going to get 8, which is going to get 2. All right. We haven't encountered that yet, but if you have any issues and obviously administering that, please let us know. One thing that the law is very specific about in our conversations regarding adoption for paid parental leave, it does not apply to any sort of temporary placement. So a foster child temporarily taking care of a child not covered under paid parental leave. It's only for the actual adoption or the initiation of the adoption process. Okay. So paid parental leave usage, another big difference between paid parental leave and donated leave is remember when you had to use donated leave, you had to exhaust all of your other leave before you could obviously use donated leave. That's not the case with paid parental leave. You can use it, obviously, if you're an eligible employee and you're experiencing a qualifying event, you can use it whenever you want within that 365-day period. You don't have to exhaust your other leave in order to use paid parental leave. Okay. Also, paid parental leave can be used on an intermittent reduced scheduled basis, or it can be used continuously. The only thing that is going to require prior approval is if an employee wants to use paid parental leave on an intermittent or reduced schedule basis for bonding purposes, that does have to be approved prior to the employee using paid parental leave. And also, if they are using paid parental leave for bonding purposes, they should be maintaining some sort of continuing parental role, which means it's the same definition as we use with the FMLA. It includes taking care of the day-to-day responsibilities of the child or financially supporting said child, same as the FMLA. So how can you use paid parental leave? Like I've already said, regardless of birth or adoption, employees can use it basically however they want. Obviously, the only thing that has to be approved prior is for using paid parental leave for bonding on an intermittent or reduced schedule basis. Paid parental leave can be used prior to the qualifying event. They don't have to start using it the day their child is born or the day they adopt that child. They can use it prior to that event, obviously as long as it's connected to said qualifying event. So for the birth, it can be prenatal appointments, morning sickness, mandatory bed rest. They can use paid parental leave in that instance. And for adoption, obviously they can use paid parental leave for maybe court appearances, social worker home visits, or attorney appointments as well. Okay. Like I said, because you can use paid parental leave prior to the qualifying event, that means whatever the first use of paid parental leave is when your 365 days starts, obviously starts at that point in time. So if they use it prior, the 365 days starts the first use of their paid parental leave. So what does pay look like while on paid parental leave? Just like obviously, what it sounds like, it is paid, obviously, at the employee's base pay. If you have, obviously, a full-time employee works 40 hours a week, then they will be entitled to the 320 hours of paid parental leave. But obviously, if you have part-time employees, you're just going to obviously calculate their paid parental leave based on how many hours they work in a week. If they don't have a consistent schedule, because I got this question yesterday, so I'm going to address it because I got a good answer. If they do not have a consistent schedule, you look back 12 months and get whatever their average amount of hours is for that year, and that's how much paid parental leave they'll be entitled to in that 8 or 2 week period. Okay? So it's just going to depend on the employees, whatever their average work week looks like. Like I said, it's paid at the employee's base pay, which is their current ordinary rate of pay. Base pay and paid parental leave is very different than we use in any other aspect at personnel. So make sure that you understand base pay is differently defined here than any other place. Also, an employee is going to be entitled to any COLA, merit system increases, or anything that they would have been eligible for had they been in the office while they're on paid parental leave. Obviously, because it's paid, you still accrue leave and things of that nature. But one thing that is specific in the law, paid parental leave has no cash value. It cannot roll over. You can't save it for a rainy day. If you don't use it, it's gone. All right. It's just simply just a benefit that you can't just keep rolling over and use it in perpetuity. Okay. If you don't use it, you basically lose it. So health insurance, also very similar to the FMLA, maintain the employee's health insurance, just like they're sitting in the office. We have to do this while they're on FMLA anyways, which I know, I might always have an employee on FMLA and paid parental leave at the same time, but if they're on paid parental leave, you maintain their health insurance. Obviously, because they're paid, they still have to pay the employee portion, so that's going to be deducted out of the paycheck, so it shouldn't really be an issue. But wanted y'all to be clear that the law does specifically mention that. So paid parental leave and FMLA, if you have an employee that's eligible for both paid parental leave and FMLA at the same time, they must run concurrently. The law specifically states that. Obviously, there certainly can be instances where they might be eligible for paid parental leave and not FMLA. But if they do become FMLA eligible while they're on paid parental leave, then it'll still run concurrently at that point in time. So requesting paid parental leave, like I've already said, one of the first things that an employee has to do to let their employer know that they need paid parental leave is filling out that certification form. If you haven't got it, it's in the manual, but I'll be happy to pass that along as well. That is something that all entities are required to use. The certification form is going to be very crucial to approving or not approving paid parental leave. Also, paid parental leave should be requested at least 30 days prior, but obviously we know that's not always possible, especially with a miscarriage or stillbirth or things of that nature. It might not be possible to give a 30-day notice, but they need to give that notice as soon as they possibly and practically can. But for example, if they're birthing a child, they're going to have plenty of 30 days to let you know that they will need paid parental leave. An employee can withdraw their request for paid parental leave anytime prior to the start of their paid parental leave. I think they need to make that request in writing. And if you have an employee that is FMLA eligible, they can't use leave without pay if paid parental leave is available. They got to use their paid parental leave first before they go on leave without pay. Okay. Obviously, after receiving the paid parental leave certification form and any other information that's required, which we'll talk about that in a minute about required documentation, you do have to let the employee know if they're eligible for paid parental leave within 5 business days. Okay. Or as soon as practical or possible if for whatever reason the 5 business days does not work. But that's probably something familiar because FMLA, we have to give that notice relatively quickly as well. Okay, required documentations besides the certification form, which I've already talked about ad nauseum at this point in time, which is obviously going to be required. Literally, I'm trying to impress upon y'all, certification form is absolutely the most important thing. We're required to do that. But also in the law, it specifically says you have to have the employee to submit a written plan. I didn't make that up. It's specifically mentioned in the legislation, and we'll talk on the next slide what the written plan should include. I do understand that most of the information on the certification form and the written plan are the same, but here we all are. I'm just giving information. This is what I've been told, and we're going to do it that way, okay? But the written plan is also a good opportunity if you want to ask for some additional information that's not unduly burdensome, you can in the written plan, which we'll talk about in a minute. In addition to those 2 pieces of information, for the birth and stillbirth or miscarriage of a child, They also have to submit obviously something regarding, why they need pay parental leave. So whether it's a birth certificate, documentation from a healthcare provider confirming birth, documentation from a healthcare provider confirming death or a death certificate, or maybe documentation from a healthcare provider confirming a miscarriage, or any sort of documentation supporting or establishing paternity. Those are going to be sufficient documentation regarding birth, stillbirth, or miscarriage. For adoption, obviously still have to have the certification and written plan for leave, but you also need just some sort of paperwork indicating that either the adoption process is taking place or it's final or something of that nature. Okay. Any questions about required documentation? Okay. Yes. Yes.
They have definitely, and that would include 12 plus the 8 weeks altogether, right? They get paid 8 weeks.
Yes, so I just want to make sure so everybody can hear. She's saying if you have somebody that's on FMLA and paid parental leave, yes, it does have to run concurrently according to the law. So the first 8 weeks of their FMLA will be paid. Whether they have any accrued leave after that, they can utilize. If not, they will go on leave without pay if they don't have any accrued leave to use after their 8 weeks of paid parental leave.
So they just not pay for them if they don't have to.
No, if they do use paid parental leave and they're eligible for FMLA, they do have to use them at the same time. It has to run concurrently. Okay. Any other questions about that? Okay. As promised, the written plan for leave. Like I said, I do understand that a lot of the information required in the written plan for leave is similar to the certification form, but like I said, it was specifically mentioned in the law. So a written plan, I think the benefit of a written plan here is obviously that you have to have the date that paid parental leave is supposed to begin or they expect it to begin, obviously within reason. Sometimes you can't always have an exact date. It's not an exact science, but also some sort of projected return to work date. But I think this is one of the more important things that you get from the written plan is if they want to use it intermittently or on a reduced scheduled basis, they should have, the employee should indicate how they plan or what their schedule is going to look like if they do use it on an intermittent or reduced scheduled basis. So they should indicate some sort of information about what the employee's anticipated work schedule would look like. Okay, obviously y'all can have a conversation about it, but I think that would be enlightening to HR folks as well. And then obviously they need to indicate how they're going to use paid parental leave. Is it for the birth, stillbirth, miscarriage, or adoption? And then, like I said, this is the catcher here. Any other information that you all might want from the employee, as long as it's not unduly burdensome regarding their absence, regarding paid parental leave. Reinstatement, return to work. This is very, very similar to the FMLA. Obviously, you have to reinstate them basically to the same position they held prior to their use of paid parental leave, and I'm pretty sure the wording is exactly like the FMLA. Obviously, an equivalent position with equivalent seniority, status, employment benefits, pay, and other terms and conditions of employment. Okay, very similar with what you do with the FMLA. So just think of it like that as well. One thing that we did add in our board rule that was obviously not mentioned in the law is an employee that has a cause to believe that their agency failed to comply with their reinstatement rights under this law can appeal to the state personnel board. So our state personnel board obviously will hear whatever the complaint is, or maybe obviously one of our ALJs, and present evidence. Any decision of the state personnel board, though, is final. Okay, so there is that small appeal right that was not included in the original legislation. That's in our board rule. Return to work. An eligible employee does have to agree in writing that they will stay in pay status for 8 weeks at the conclusion of their paid parental leave. That's also specifically mentioned in the legislation. It doesn't matter who's taking it. If they're taking for 8 or 2 weeks, the law specifically says have to remain in pay status for 8 weeks, regardless of who takes it or how long they use it for. Okay. If an employee does fail to remain in pay status for 8 weeks, the agency can substitute accrued leave or deduct any uncovered leave from the employee's final paycheck. Obviously, all of what I just said can be waived if they're unable to return to work because of a serious health condition of an immediate family member. That's also specifically mentioned in the law. So how to code pay parental leave in HRM. This is a slide with just strict information on it. I don't speak to how this all plays out in reality because I don't do HRM. That's our payroll people, which I did shout them out yesterday. If you have questions about how to code pay parental leave in HRM, Sherry and Nikki are your people. And I already told them that I'm going to shout them out, so they will hopefully be anticipating maybe an influx of calls if you have questions about it. But like I said, I'm not the HRM expert, but do know there are different usage codes, obviously based on females and males, because one can use it for 8 weeks, one can use it for 2 weeks. But also notice there's also 2 different codes within each section if they're going to use it just paid parental leave strictly, or if they're using paid parental leave and FMLA at the same time. We do have to code this the correct way because the legislation does require state personnel to report any information regarding paid parental leave. So we want to make sure y'all are coding it correctly so that we can report on it correctly to the legislator and the governor. So if you have questions or concerns or are not sure if you're doing it right, do get with Sherry and Nikki about that as well, because we want to get accurate information to those that pass the law. And that's it. Does anybody have any questions for me? Yes, ma'am. There are no dumb questions. So she asked if, for those that couldn't hear, she's like, what if they experience some sort of catastrophic illness or injury related to the birth? As long as they meet the definition of a catastrophic illness or injury regarding donated leave, they can still be eligible for donated leave. Like maybe their child has a catastrophic illness or injury after they're born, that could qualify for donated leave. But I'm not going to say it always will, and I'm not going to say a blanket statement, but certainly I can think of instances in childbirth or after the child's born where it might be a catastrophic illness or injury. But just because you're experiencing like maybe a minor complication doesn't mean that it's going to rise to the level of a catastrophic illness or injury. But strictly for maternity adoption, like it used to be, it's not available anymore regarding donated leave. Any other questions? Yes.
I have an employee that's due to deliver in December.
Mhm.
Is it too early for her to turn in her PPL certification?
Yeah, you can do it. I mean, it's up to you. If you're, I like to get things done early. If you're that kind of person, that's fine. Yeah, I mean, obviously, if they end up having the child maybe like a month earlier, you might have to get some like new documentation from the healthcare provider. But yes, if they want to go, or if you want to go ahead and get them to do that, I have no problem with you trying to do things ahead of time instead of behind. So that's fine with me. Any other questions? All right, y'all have my email. I'm happy to answer any questions that you maybe didn't want to answer. But like I said, if you have any payroll specific questions, make sure you get with Sherry and Nikki about that. But otherwise, you can call SBD Legal with any other questions you might have. Thank you.
All right, everybody, moving on. Thank you, Lexi. So much information. She's always so good at presenting it. And so now I'm going to introduce Nick McKay. He is with Empower, and he is going to talk to us about some of our retirement benefits. So y'all give him a warm welcome.
Thank you. That's my remote. Let's figure out how this works. Hold on. Oh, there we go. Other way. There we go. Hey everyone, my name's Nick. I am with Empower. We are not a state agency ourselves. We're kind of like your health insurance, right? We are a third-party agency contracted to provide an exclusive state benefit. That benefit is your optional deferred compensation plan. Okay, so we're going to go through some of the benefits today, give you a good overview of what you can do with your retirement plan, how you access it, how you take advantage of it, things like that. So, when it comes to retirement, all of you as state employees are building into what's called your pension. Sometimes you'll hear the state call it your ERS benefit. That's amazing. Pensions are very rare nowadays. Value that pension. I cannot stress that enough. But on average, pensions only replace about 30 to 50% of your total income when you retire. Now, very few people can afford to retire and take up to a 70% pay cut. So on top of your pension, the state gives you 2 optional retirement plans where your pension is mandatory. It's going to happen automatically without you doing anything. Your optional plans, you have to decide how much money comes out of your check and goes into that plan. So when you're thinking about your retirement, you really want to think of it in different tiers. Where's your money going to be coming from, right? The base of your retirement will be that pension check, because as long as you've worked for the state for 10 years, you're going to get that check for life. On top of that, you'll have your Social Security, we all hope, Social Security has been changing a little, but right now you'll have your pension, your Social Security, and that third layer of your retirement will be what you save on the side for yourself. Now, the advantage of saving that money in a retirement plan, because I know a lot of you are saying, well, why don't I just stick money under my mattress or put money in my savings account? The base level of all retirement plans is that they give you a place to put money where you don't have to claim that money. You can put your money in pre-tax. It basically means that it comes out before you ever pay taxes on it. The money gets to be invested and grow without you having to claim that growth every year. As long as you don't take the money out, you will never get a 1099 or something showing how much money you earned that year, which means you don't have to pay tax on those earnings until you decide to withdraw the money. So it gives you an account where you can save money, where that money will grow over time, where you don't have to constantly keep paying tax or capital gains tax or growth on that money. So that's just true for all retirement accounts. IRAs, you're going to hear about your RSA 1 plan later, this account, that's just base level how all retirement plans work. It's a place to put your money where you don't have to constantly keep claiming that money. Now, I'm going to run through these slides a little quicker because I want to talk to you more on just a personal level. I feel that these slides, for one, you're going to see a lot of them again later with RSA 1, but they don't really convey how important retirement plans are in general. And my job as your state advisor is to make sure you know what benefits you have and how important all of this is. So I don't want to focus so much on just this plan. I just really want to convey to you how important retirement is in general and how saving for it can really set you up. So right now, in your retirement plan, all of you have a limit that you can contribute each year. That limit's $23,500. It's a very high limit. Very few people will ever be able to afford to hit that every year. But the fact that the IRS puts a limit on it at all should be your first big clue of how valuable retirement plans are. I promise you the IRS does not limit things that you can't take advantage of. So the fact that they put a limit on it should be the first big flag that, hey, there's something I can take advantage of in here. Now, if you're over 50, you get an additional $7,500. So your limit would be $31,000. Now, this limit tends to go up a little bit each year, hopefully. They do skip some years. But just know that regardless of how many retirement plans you use, this is your total limit you can use each year. If you're under 50, $23,500. If you're over 50, it's $31,000. And they just passed a new law this year that if you're over 60, you get an extra $1,250 as well. Now that one only lasts for 4 years, ages 60, 61, 62, and 63. So depending on what age you are, you'll have different limits that you can take advantage of. Now, there's different ways to put money into your account. First big one is pre-tax money. And that's exactly what it sounds like. That's what I just alluded to a minute ago. Pre-tax money comes out of your paycheck before you ever pay tax on it. You get all the benefits of pre-tax contributions right now. That's how I want you to think of it. If you choose to do pre-tax money, you want that benefit right now. Because what it does is not only do you not pay tax on the money going into your account, but it actually gets deducted from your overall income. So you pay less tax on the rest of your paycheck as well. Now, the strategy behind that is that while you're working, you tend to be in a higher tax bracket. When you retire, most people fall into a lower tax bracket. So the strategy is to use pre-tax money, avoid that higher tax now while you're working, and then when you retire, you can pull that money out at the new lower bracket. That's the way it will hopefully work. Now, the other kind of money, Roth money, that is the exact opposite. Where pre-tax money, you get all the benefit right now. Roth money, you're looking for a benefit in the future. So Roth money has two rules. It says that as long as you've had the account open for at least 5 years, meaning that that first dollar you put in has been in the account for at least 5 years, and you wait to take the money out until you're 59 and a half, which is pretty close to normal retirement age. If you can wait till then all of the money that your money has earned over the years, you will not have to pay tax on. So you pay tax on the money that came out of your paycheck, but then as that money earns, you avoid tax on all of those earnings. Now, that gets better the longer Roth money sits there. Obviously, the longer your money sits there and earns money, the bigger tax break you're going to get. So general rule of thumb, if you're already in a high tax bracket and you're a high earner now, pre-tax money is usually best for you. If you're very young and your money has a long time to sit there, or if you're already in a low tax bracket, Roth money is normally great for you because you can lock in your low tax rate now. And as long as you wait to touch that money until you are close to retirement, you won't have to pay any tax on your earnings in the future. Now, there's 3 things you can do with this account, 3 ways to invest. One is as money goes into your account, you can handle your investments yourself. You can say, I want to do it myself. I know what I want to invest in. I don't need any help. And you have the power to log into your account and move your investments around as much as you want so that you can see where your money's going. You can also have us help you with it. Do it for me basically means you want to be completely hands-off. You don't know anything about investments. You don't want to talk to anyone. Just handle my investments for me, and we will gladly do that. Then you have help me do it. This is where I come in. One of your best state benefits is that as long as you have money in your Empower account, even $1, as long as you have any money at all in there, the state pays for all of you to have a dedicated financial advisor. Wherever you're at in the state, whatever county you work in, we will have a dedicated financial advisor come out, meet with you one-on-one, and go over all of your retirement finances with you. We can calculate your pension value, Social Security. We'll calculate how much money you're going to have in this account based on what you're saving. We'll go over everything and really give you a great look of when you can afford to retire. So Help Me Do It is where me and you sit down together. We go over all your investments together, and I help you make the best choice. That will never cost you anything extra. That is all built in as part of your plan and part of your benefits. So the criminal part of this is that only 49% of state employees have met with their financial advisor. That number is way too low for something that doesn't cost you anything extra. Please meet with your advisor. And again, even if you're very smart and you can handle your own investments, meeting with a free financial advisor as part of your plan can never be a bad thing. Even if you end up not taking our advice, having someone calculate all your numbers and showing you where you're at is very valuable. So please take advantage of that. Now, your investing options with the plan. One nice thing about this plan is that the state of Alabama has selected a huge range of investment options. Now, normally that could make your plan more complicated because you have more choices of what to invest in. But as I just said, all of you have a dedicated financial and investment advisor. So if you get too complicated or get confused by all of your options, you'll have one of us to call and go through it with you. But in the plan, you can invest in target date funds. Target date funds are a very hands-off investment. It's basically a computer picking your investments for you based on the year you tell it you want to retire. So if you pick 2060, because you're very young, then the computer knows, hey, you've got over 30 years to invest. We're going to be more aggressive with the money and try to see some growth. Every year you get closer to the date you picked, that account will automatically get a little bit more conservative every year. So that as you actually approach your retirement year, the account is now much more defensive than it was while you were young. So it's just a very easy hands-off investment that works good for a lot of people. Now you also, and this is a good chart showing it, but as you're younger, you'll be much more invested in stocks and things that are looking at growth. As you get older, you will naturally just come in more to bonds, less in stocks, and your account will just get more and more conservative each year. Then you have the individual funds. A lot of these will hopefully look familiar to you. We have the S&P 500 or large cap funds. You have mid cap companies, small cap, international, bond funds. You can invest and be all over the market. We want you to be as diversified as possible so that you're protected from loss, being in just one sector of the market. Now, my total retirement. This is for the do-it-for-me people. People who don't want to talk to their advisor a lot, want to be very hands-off, but you still want an actual person watching your investments rather than a target date fund. Then my total retirement, that's what that does. You basically tell us, hey, I want to be hands-off. Please just handle all my investments for me, and we will do that for you. This is the only thing in the plan that comes with an extra fee. Is basically saying, hey, I want you to manage all my investments and I don't want to have to talk to anyone. So that is the only thing in the plan that will ever have an extra fee with it. There will never be any kind of extra fee for meeting with your personal advisor or getting advice from us one-on-one. Now, here we go. Getting ready for retirement. This is where we talked about where your money's going to come from. So again, main places, pension, Social Security, and your account that you've saved money in yourself. Now, I want to go ahead a little bit to your advisors. Or actually, let's cover the website first. So all of you already have an account with our company. The state creates it for you when you get hired. So if you go to alabamaretire.com, or if you download our Empower mobile app, all you have to do is click this green register button, type in your social, date of birth, and zip code, and it will pull your profile up for you. That doesn't mean, money's going to automatically start coming out of your account. One of the best things about the plan is that you can control what comes out of your paycheck right from your phone or computer. So after you log into your account, you'll get to look around and see some of the benefits. And then right on the home page, there's an edit/add button to control what comes out of your paycheck. I want to be clear, you can change that as much as you need. There is no limit on how often you can change what's coming out of your check. So if, you want to raise it after you get a raise and save more money, you can. If you need to pull it back during the holidays because more expenses are coming up, you can. There's no forms you have to fill out. There's nothing you have to send in. You can do it right from your computer. Now, main takeaways of this, and the page I want to talk about most, is this one. Please take a picture of this. These are all of our dedicated advisors, and those are our cell phone numbers. You are never going to call your advisor and end up on hold with a customer service agent in another country. You have a dedicated advisor in your area. Please take advantage of it. You can call us, text us, email us. Being able to instantly reach out to someone if you need help with your money, if you need help accessing your money, anything, you have a dedicated advisor to do that for you. So please take advantage of it. Now, I ran through this pretty quick because I want to talk more about, I want to talk more about just some of the base benefits of retirement. But before that, are there any questions about how this works, how your money grows, how you access your money? I mean, anything at all? Yeah. Yeah, so if you're enrolled, and she asked if she was paying fees, if you're enrolled in My Total Retirement, the highest fee you would be paying is 0.45% of whatever your account balance is. Now, if you're not enrolled in My Total Retirement, meaning your money is just in a target date fund or you allocated it yourself, then there are no extra fees for that. Yeah. Yeah. If you're enrolled in what? Yes. You can. Yep. Just so in case you heard that, they asked if you're already enrolled in My Total Retirement and you want to unenroll from it to avoid that fee, you can do that as much as you want. There's never any penalty or cost for unenrolling from it, and you can re-enroll in it again whenever you want. So if you want to enroll in it, test out what the returns are like and how we manage your money, and then unenroll from it, you can do that as much as you want. It doesn't cost you anything extra. Absolutely. Yeah, you can either call us or our customer service team, or you can even do it right on your phone. Yeah. Anything else before we kind of go over some basic stuff? Okay, good. So, like I said, the main thing I want to stress, for one, you have two plans. You have this plan, Empower, and you have the RSA 1 plan. Now, again, they both share that same retirement limit. So even if you do use both plans, make sure you always keep in the back of your mind $23,500. If you're going to use more than one retirement plan, you need to track that yourself. Neither company will know what you're doing with the other company. So I want to touch on some key differences between the two plans. So what I said about being able to change your contributions as much as you want, with Empower, you can do that right from your phone or computer. With RSA 1, you do need to send in a form to them. And someone does have to actually process that form, so it does kind of add some work to them. So, Yeah, with Empower, you can change pretty much anything, beneficiaries, what's coming out of your check, take money out of your account right from your phone or computer. With RSA1, you're going to normally need a form to do those things. Second biggest difference with the plans is your advisor. The state of Alabama only provides advice for you if you have money in the Empower plan, not the RSA1 plan. That has nothing against RSA1. They just don't have advisors for you to speak to. So there's nothing to provide there. So you will have a dedicated advisor as long as there is money in the Empower plan. But if you don't have any money in there, then there's not a lot we can advise you on. Third biggest difference, access to your money. Now I want to start with, this is a retirement plan. Hopefully you are not accessing your money until retirement. The goal of all retirement accounts is to put money in there, ignore it, and let it grow. But it's still your money. If you need access to it, it should be there. So with the Empower plan, you can take loans from yourself, up to half of your account balance. Completely tax-free. IRS doesn't even get to know about it. Nice thing about a loan to yourself is you make all of the interest on the loan. So obviously we still have to follow whatever interest rate the Fed sets. But because you borrowed the money from yourself, you make all of that interest. So if you borrow money out of your account, as you pay yourself back, more money will go into it than you borrowed. So you do have access to your money even while you're working. You can also take emergency withdrawals from it. And at 59.5, which is that magic Roth age as well, your account basically fully unlocks. So that at 59.5, whether you're working or not, you have 100% access to your account. You can basically treat it like a very well-earning savings account at that point. Take money out every day if you need. Now, obviously, if you're not working, then as soon as you leave service, your account unlocks for you as well. If you're not working, you have immediate access to the account. Now, that's one of the best things about your state retirement plan. And this is true for RSA1 and this Empower plan. There is never any kind of early withdrawal penalty on a 457 plan, meaning your state retirement plan. So even if you leave your job early, if you quit, if you just need money because something happened, you will never have to worry about paying any kind of extra tax or penalty. That is exclusive to 457 plans. If any of you have ever had a job outside the state, you probably had a 401k. If you take money out of a 401k early, you will pay a hefty extra tax on them. An early withdrawal penalty and additional tax. Those just do not exist on your government retirement plan. So I don't want you to think that any money you put into the plan is just locked away from you. You can touch it if you need to, and you won't be penalized if you have to touch it. So, again, are there any questions? Just any questions about your money in general, how your pension works, how this account works, anything at all? No, all right, guys, like I said, only 49% of you have met with your advisor. Please call these numbers. Even if you end up not taking our advice, sitting down with someone and having them calculate everything for you is incredibly valuable. Please take advantage of it. All right, thank you.
Y'all, I met with my account advisor and it was so nice. So take his advice. All right, so now I am going to ask Casey Keefe to come up with Prime Therapeutics. And then I'm actually going, while Casey's coming up here, Ethan Ivy, are you back there? Maybe not. Okay, we'll do his giveaway. Oh, you want to do your giveaway? Come on. No, I'm going to do his and I'm doing yours like that. Yeah. We're going to go ahead and get Ethan up here to do his giveaway real quick. Alfreda wants to know if it's too late to enroll. All right, she's over there. Well, all right, y'all, come on. All right, so we're going to let all these people enroll. We're going to go ahead and listen to Casey. Now, has everybody enrolled in Casey's giveaway? This is for Amazon gift cards, so don't be coming up late. I know, Artia. Okay. Let's, y'all go ahead and start writing your name down for whichever giveaway, okay? We're going to go ahead and let Casey come up and talk about Prime Therapeutics, and then we'll do the giveaway right before lunch. Sound good? All right, y'all raise your hands if you need stuff, and I'll come around and get it for Casey, okay?
Appreciate your time this morning, everyone. Thank you. I know it's getting close to that lunchtime, and so I don't want to drag on too long, but I appreciate the time this morning. My name is Casey Keefe, and I'm Can't hear me at all? A little bit better. All right. My name is Casey Keith, and I'm a member of Prime Therapeutics, and I'm responsible for the overall account satisfaction. So I'm here to actually help you all understand what we do, and if there's any issues, that you please come talk to me afterwards. But want to get started here. Just give you a quick rundown on what I want to talk about. First, give you a little break on what Prime is, and then talk about next year and member support, some of the programs that we're offering. So a little bit of history on Prime and what we do. We are your pharmacy benefit manager. We're responsible for your pharmacy services, so all your RX drug plans and all of that, formularies, your pharmacy networks, etc. So as we get into this, just a little bit about what you may have heard in the news today. There's a lot of information talking about drug costs and what's happening in the market. And Prime is trying to do a little bit different things this time around than some of the other larger competitors you may hear of. And so a little bit about Prime is that we are trying to be transparent and conflict-free in everything we do. We don't own our own pharmacies. We don't limit you to certain networks or to certain pharmacies in general. We are completely transparent and conflict-free in that regard. So what you see is what you get in terms of the best opportunity by not locking you into pharmacies to drive our own parallel business. We are looking at a holistic experience that we are taking a peek at pharmacy data, medical data, trying to provide the opportunity for your health plan to better understand how to give you the best health and wealth along this path. So in addition to that, the most popular or the most important thing I can say today is that, looking at purpose beyond profits for us, we believe in doing well by doing good. And in that case, we are not owned by, or we're not a public company. So we're owned by 17 different Blues plans, all working towards basically pursue the lowest cost of care solutions for our clients and our members. So that is the goal of us, is we don't have to respond to Wall Street or the quarterly earnings. We can do things that we believe are going to be more beneficial without worrying about profits or returns. So looking into next year, as you mentioned, in a lot of cases for the plan design, your plan design for next year will not change. It remains exactly the same. The formulary that you use today always sort of modifies it. It's going to be adjusted on the quarterly because new drugs come out, generics become available. You may have heard that biosimilars are now very strong in the market, and so those will come onto your formulary, and older drugs will come off the formulary. But no major changes for 2026 or 2026. But again, if you have any impacts in that case, you will receive letters. Your members will receive letters notifying you of what those adjustments would be. Your retail network changes, you have roughly 66,000 pharmacies at your disposal within our network. As I mentioned, again, we don't limit you by who those pharmacies or who can fill at those pharmacies. There's over, I think, 1,200 pharmacies within Alabama alone, so your members are able to fill wherever they need. Specialty is a little bit different. So specialty requires certain handling, certain delivery, refrigeration, things like that. So we do require that specialty pharmacies are filled through, specialty drugs are filled through the Accredo Specialty Pharmacy or the State Wellness Center. So if you have members of yourself around specialty drugs, you will be required to continue to fill through those two pharmacies. That said, we do allow that additional pharmacies can be brought into the network as needed. So if you have friends, family, or acquaintances that run pharmacies, if they're not part of the pharmacy network, they always can join without issue. So we are an open pharmacy network in that regard. Last thing is the member inquiries for next year. The Blue Cross team that's back there does a wonderful job, and so we have partnered with them to manage all of the incoming questions and issues that you may have. So please contact the Blue Cross Blue Shield on the back of your card. That is the same as what we use today. So Prime and Blue Cross has partnered together to make sure that you have a one-stop shop of contacting for any questions, issues, support, and then that basically transitions to Prime after hours. So you're seeing the same people over and over. You have one card you have to use, one pharmacy number that you can use. It's the same card as you have in your pocket or your wallet or your purse today. All of that's available. None of that is changing as well. So be aware that you can reach out to those folks and get any questions you have. If you don't feel like using the contact center, you have the My Prime portal, which we've had a lot of good questions over the past couple of days about the My Prime portal. I want to talk about them a little bit. So as everybody's aware, you have apps, you have portals, you have things that are going to be providing you information at any given time, and this is no different. The My Prime portal allows you to be able to sign in and identify things that are specific to you, being able to identify where you can find your drugs, your pharmacy. It'll actually show you a drug formulary, which drugs are actually able to be covered, which are not covered, generic alternatives or alternatives that they are not covered. You can see your claims history. You'll see drug-to-drug interactions, which are issues that you may not be aware of, but you want to be cautious of, as well as you review your claims history or plan information. Now, some of you may be pulling this up on your phones now, and you're wondering why you don't see all of your family members. And that's because, if you do and you don't see all of them, it's because only your dependents who are under 18 years old will show up. So your husbands, wives, or adult children have to sign up on their own. You can't see, we don't allow PHI for adults. So if you look on your app and you don't see someone you love as part of your family membership, then that's probably why. So be aware of that if you're looking at that. Also, on the My Prime, you can track your prior authorizations. Again, another big hitter in the news today is prior authorizations and the time that they can take. Because it's important for prior authorizations to be part of the drug schedule, it's important to track them. So if you're familiar with prior authorizations, we do require them for certain drugs to maintain efficacy, for maintain cost structures, containment, as well as making sure that the providers are also choosing the right drugs and providing them in the right manner. So with prior authorizations, because that timeline does coordinate between a provider, a pharmacist, and your PBM delivery, that we ask that you can be able to track it. So you can track all of your prior authorizations, the statuses, any response and communication you may receive from us or your provider here in one local place. The last thing I want to talk about is some of the programs. Now, these become available to you without having to sign up in many cases. And some of the programs are automatically enrolled depending upon the members who are using them. So to talk a little bit about specialty, the Flex Access program is a copay assistance card program that some of you may be aware of. Specialty drugs are very, very expensive, and they are generally aided by the manufacturer, and that they will provide copay assistance to those members to help reduce the overall responsibility, i.e. your copay. In a lot of cases, you could have specialty drugs being on a higher tier, and so they carry a much higher copay. Well, the manufacturers and your PBMs, the self-primes, have built programs that allow those to be utilized and reduce the overall cost for yourself, your members, as well as the plan. These are very active in saving a lot of money for each of those programs. And so what it basically does is, once the member signs up for the copay program, it reduces the overall copay to anywhere from $5 to $35, which could be several in the area of several thousands of dollars. So that is automatically available to them. They'll need to enroll to make sure that they are using those drugs. But there's also available point of sale for some of you who are using brand drugs and even generic drugs to help reduce those even further. One of those programs is Meds Your Way, and this is a program we implement at point of sale. So you don't have to sign up for it. You don't have to even be aware of it. But if you use some drugs that are generic, even those that are not even on your formulary, we can provide you lower discounts. And what happens is, as the adjudication, if you will, happens, it reviews all the different potential types of cost structure, be it a copay card, be it a cash price, or even your prescription drug price. And it will find the lowest out of a mix of probably 10 or 20 different cards and automatically apply that cost to point of sale. So the effort is trying to reduce those costs for generics or drugs that are non-formulary, so you can receive the lowest cost at point of sale. A few others. Specialty pharmacy is really a product in and of itself. So if you're familiar with specialty drugs, they are basically for 1% of the population of every plan, but yet they cover more than 50% of the cost. So they are tremendously expensive. And it's not just because they're costly, and it's because of what they do. I mean, many of them are extremely effective. You've probably heard of Humira being the super drug that it is, that's now covers 10, 12 indications, and it's helped millions over the course of its lifespan. But In the case of what's required for specialty drugs, we do require that a particular pharmacy manage those drugs. And so Accredo is doing that for us. And again, as you can see here, they'll help with the safety and efficacy of those drugs, as well as the delivery and any plan coordination that you may need to have in order to utilize those drugs safely. So Accredo is going to be the one that we use today. It's the same as you're using now, as well as the C Wellness. But with that, it is important that you build one of those profiles again. Another one you have to sign up for again, but it will also understand where those drugs are at certain times. If you're on specialty drugs, it is important not to miss, to maintain those schedules that you're on, and these will help you track your drugs, make sure it's delivered on time appropriately, because they do require in some situations to be signed on to sign for your drugs. Also, they may need to be refrigerated, and they need to be delivered in a certain amount of time. So I would recommend that if you do use specialty drugs, or any of your members use specialty drugs, for them to create that account, and they can be aware of where their drugs are at all time, and it just assist them in managing that. So before I go on just a little bit more here, a couple of these programs are just in place today. I want to just mention a few of them that are highly organized. And one of them is the Guided Health Program. This is a medication therapy program that aids members with chronic services and serious chronic issues. So multiple prescriptions, multiple visits across both your medical as well as your pharmacy. These will actually work together to maintain and make sure that those members are not having any drug interactions, and that they can manage those prescriptions along both of those the avenues of care. Next would be integrated RX, and these are for members who have additional complex diseases like oncology or cystic fibrosis. And what you may see when you're going through those pretty scary diseases would be the ability to stay with where you are with your provider and have the pharmacist give you the same information as what they're working as you're seeing, right? To work together with your provider at the same location, to be able to dispense those medications together. So you're not running from place to place trying to determine, all right, why do I have an interaction? Why can't I get my drug? Why am I having problems with prior authorizations? In efforts where we have those serious diseases, we want to make sure that that's as easy as possible, and your members can have that care without feeling like they need to spend their time trying to identify the drugs. This brings it all together, allows them to find the drugs they need from the care and the providers that they've already chosen, without having to move from location to location. And the last one is a program that we put in called High Touch RX, and this is really strictly working for the plan, but it also impacts all of the members. And that's a program that we use data analytics and AI, of course, to identify savings opportunities across the board. So this uses analytics to determine if there's duplicate therapies within your members' usage, if there's dose monitoring, oversupply, lower cost alternatives for drugs that they should be using, and these overall 10 clinical rules that we applied across the board. So, as I mentioned, there are several things in place today. We are building out several more that you're probably going to be hearing of. If you're part of that lucky group that can be applied to this in new groups, you're likely to receive notification to us or from us. And I know that you probably get a lot of stuff from your health providers as well, but I would pay attention to anything that's coming from Prime, simply because it's dealing with those drugs, right? Being aware of there may be changes in the drug program, the drug regimen within your formulary, and it may require your willingness to change, or actually your need to change. So be aware of those things coming out to you. Use My Prime to identify those drug opportunities and to manage your own accounts. So if you have any questions for me, I'm in the back corner. I'd be happy to address. Yes. I'm sorry, I didn't catch all that. So based upon your benefit, yes, you can get 90 days of, I think we're still limited to a 60-day supply. I think we got a 60-day supply limitation for some of those drugs.
But you can always email, if you want to email me, I can definitely send it to Casey, and we can double check for sure.
Yes. Yeah, summary slides these are all going out, right?
Yeah.
Yeah, I believe all of these are going to be delivered out.
So what would be the cause that, like, our pharmacy was dropped from you guys, and it took like 3 or 4 months for this to come back in withdrawal?
So pharmacies have to credential themselves, meaning that they are going to follow the same rules as everybody else requires, and that could be that you're going to dispense against the proper rules, that you're going to dispense in our network against the requirements that we have. Billing operations, the same things like that. And as pharmacies join different, what they're called PSAOs, they're basically purchasing organizations, allow them to join bigger networks, or if they get purchased, sometimes that can fall off because that group isn't part of our network, or they don't finish in time, just different variations of things about needing to be part of it. But if something does fall off, that's where I would advise you to jump on My Prime to make sure that you have alternatives in your area, that you can have that pharmacy available to you. We can help you move that script if you'd like to a different pharmacy. But if you want to stick with that pharmacy, and if they're not in our network, then I would advise them to reach out to us so we can get them back in. Yes.
Is that they have gone to get their assistance and not knowing that there was no coverage because it wasn't communicated to them. And so combines with root cause, is that going to be better communication? When it comes to me, I can't really think of, consider root cause, call NCIB, but they just weren't being notified that their medicine was no longer covered until they got to the pharmacy to find out.
Yeah, a couple of points to that is first is to indicate, when I say that when we're sending out letters to folks, I know they could often be overlooked, be thrown out, but anytime that there is a change in the formulary, that means that the entire drug list that we put together, if there's a change in that, we do letter all of those members to say, this is being changed, it's going up in tier, or it's coming off that. And I understand that those can, sometimes be just thrown out and people miss them, and then by the time they go try to fill, they don't understand why it's not on formulary. But if that's the case, and I would ask all of you that, I know it's common to want to go back to SEEB and ask them questions about this, but the Blue Cross folks and the Prime folks who run those call centers are all very aware of all the changes that are happening. So I would advise you to please make them call or ask them to call Blue Cross at the numbers that I provided to make sure, because it's a much faster turnaround for them to be able to identify and say, that drug has recently come off, this is the new alternative, we can help you by contacting your provider, any new prior authorization that may be needed, we can help assist that. And it's much faster turnaround than having to ask the plan to come to us, to come to them, and so forth. So while we're happy to speak with the plan and anyone there, it's just a faster turnaround for your members. Yes.
What is Prime doing to help keep the cost down? I had drugs go up as much as 600% last year. We had one that went up, the cost went up $1, took it to another tier, to where the brand was actually cheaper than the generic.
Yeah, so that is very common in the industry today, where prices are growing significantly, right? We figure there's about 10% overall every year where you see prices increased on certain drugs. Well, this is where it's important to understand your formulary. For instance, in those cases, if drugs go up in tier, there's likely because there's generic alternatives. And that's just what's happening in the market is, drugs are being, they're coming off of their patent. And so generic alternatives become available. And so it is our role to make sure that there are lower cost alternatives across the board in any of those instances. Now, here are the things with that one example that you mentioned where it jumped up to say $600. And I won't get into the details where we choose brands over generics, but the reason would be in that case is that on the overall, the cost of that brand would be lower overall, right? With the case of rebates, with the case of copay assistance cards, that the cost of that drug in the aggregate is going to be lower than actually the generic. And that usually happens when there is a brand new generic available. So we analyze on a quarterly basis all drugs that are coming out, all new availables, all alternatives, to identify those options that we may adjust to our formulary. That's why we do adjust our formulary quarterly to stay up with any adjustments to the market as well.
If you went
And that could be just the difference in formulary. So previously, you all were thought, and they used a formulary different than us, right? And so we may negotiate with manufacturers a little different than they have, and so we're looking at alternative drugs. And so my question to you would be: is have we looked at alternative drugs for you that may be much less expensive than that particular drug? Because our negotiations with them could be for a different drug, with manufacturer for a different drug, and that overall cost could be significantly less. Now, if there are cases where that drug is guaranteed to work for you and you don't want to change, then there are options that we can work with you in the plan and copay manufacturers to reduce that cost. It's just, you have to be aware that they're out there. Savings are out there, and we will assist you. Blue Cross will help you, and we'll work with the plan to make sure that your members are getting lower cost alternatives when they're available.
Are there any changes coming up, or if we started doing research now, is it still going to be good research in January, February?
So, great question. The most recent formulary changes are just been determined, and they're very small in this case. And so all the people that will have changes will occur January 1, and all the letters are being planned to go out right now. So you're required to have at least 60 days of notice prior to the actual change in the formulary. Any other questions? Yeah. Yeah, the administration right now is doing what they can to reduce the overall cost for manufacturers, right? That's where everything starts, is in manufacturing. They set the prices, and we try to negotiate the cost as low as we possibly can. As the root cause of the gross cost of those drugs is decreased, you would certainly see those decreased overall. And I know that there's a lot of concern around what's being said in the market as far as, if tariffs are going to impact drug cost. And I will tell you right now that in the most the easiest way I can say this is, if tariffs are causing drug costs to increase, or if they decrease by manufacturers, really right now those are, I would say, unwarranted. Most of the impacts are going to cause on very small amount of drugs. It's not going to be on your generics. It's not going to be on drugs that have manufacturers that are building within the United States. And generally those that are impacted are going to be foreign-based drugs that have alternatives. So I don't think that there's going to be a gross jump in this. I think the bigger issue is the overall drug cost being increased by manufacturing year over year. That's a great question. That's State or Senate Bill 252. Am I doing it?
You're good. You can keep going.
Senate Bill 252, which just went into effect on the 1st. And what that did is it required independent pharmacies in Alabama to have an increased dispense fee and to change their acquisition cost. So overall, I don't believe it's going to cause any really impact to the members. The acquisition cost of those drugs is significantly lower. So adding a dispense fee that seems to be significantly higher, $10.64 versus say 30 cents, will still keep that drug fairly low. And in many cases where we run examples, it's lower than it was previously. So it's a way for the independent pharmacies to continue to operate and continue to make money in cases where they are not, where their cost of goods are not as equitable as, say, a giant retail chain.
Well, and that's also, of course, where you decide to get your pharmacy, what pharmacy you choose.
Absolutely.
Sorry, I didn't know if you wanted to elaborate.
That's a good point. So what you said is it also helps you identify where your pharmacies are at. So again, on My Prime, you can find your formulary. You can price a drug at different pharmacies. So if today you fill it at an independent and you want to move to CVS, you can go verify and check those out, make sure what the costs are going to be. So it will actually tell you, and you can find lower alternatives together. So I would make sure you're aware of that and sign up today. Any other questions? All right. Well, I appreciate your time. Thank you so much.
everybody on the same piece of kind of paper, so I wouldn't cheat.
Oh. All right. Let's
How many do I need?
let's do all four.
Okay.
Do it now.
Yeah.
Send you off to lunch. Good. All right. Bridget Rollins. Oh, somebody knows who it is. Tracy Bird. Where you at? Where's Tracy?
She's right there in the blind.
Oh, okay. All the questions and you win. Right on. Shamika Farrow. And Kimberly Hollifield.
Hey.
Thanks, everybody. I appreciate it.
All right, thank y'all so much. Great questions, very good questions. Now I'm going to ask Ethan to come back up, and we are going to do our door prize. And then guess what? Y'all going to go eat.
Awesome.
I know.
I only have one, so sorry. Do you want to pick it out or you?
Oh, I'll do it.
Okay.
I get real nervous. I know I start sweating. You want to do it now? Okay. Yeah, we can do it before and after. Alicia.
The Alicia Corbett?
Uh-huh.
Awesome.
Okay, thank you. And then we've got Miss Carolyn from ACI. We have two giveaways, so I'm going to go ahead and do one before lunch, and then we're going to do one when we get back for lunch. Because who doesn't love a giveaway, right? So I'm going to let Miss Carolyn, and then I'm going to get you to come and speak when we get back.
Okay, no problem.
You want me to do it?
Go ahead and draw. Make it fair. It's Felicia McBride.
Congratulations. Okay, y'all, who doesn't love free things? Okay, so we are gonna let you guys go to lunch, and when we get back, we will hear from ACI, and then we will get the afternoon started. I'm starting back at 12:30 sharp. Okay, so y'all go enjoy your lunch. You can thank me later. I know. Yes. All right, y'all be back before 12:30. I will start at 12:30 sharp.
You use the audio. Stop the stream.